Hello everyone. So today is my last day of nursing surgery task and I am going to be talking about identifying the signs and symptoms as well as treatment for common emergency situation. So first up is recognizing medical emergency. So getting medical help right away for someone who is having a medical emergency can save their life. So according to the American College of Emergency Physicians, there are several warning signs that shows that it is a medical emergency. For instance, bleeding that will never stop, breathing problems such as if a patient has difficulty breathing and shortness of breath, or change in their mental status such as unusual behavior, or if the person has a confusion or difficulty arousing. There is also chest pain, choking, coughing up or vomiting blood, fainting, loss of consciousness, feeling of committing suicide or murder. This is mental health, head or spine injury, severe or persistent vomiting, or sudden injury due to a motor vehicle accident, burns or smoke inhalation, near drowning, deep or large wound or other injuries, sudden severe pain anywhere in the body, sudden dizziness, weakness or change in vision, swallowing a poisonous substance, as well as severe abdominal pain or pressure indicates that it is a medical emergency. So as a bypasser, or if you are a medical student, what you should do, you should determine the location and the quickest route to the nearest emergency department before an emergency happens, and we should keep emergency phone numbers posted in our home where we can easily access them. We should also enter the numbers into our cell phone or everyone in our household, and these numbers include the fire department, police department, poison control center, ambulance center, a doctor's phone number, and many more. And we should also know which hospital our doctor practices so that if it is easy. We should have a medical identification tag if we have a chronic condition, and we should also get a personal emergency response system. So what to do if someone needs help? First of all, we have to stay calm and we have to call our local emergency number. Then we should start CPR if necessary, which is cardiopulmonary resuscitation. Check for their pulse and their breathing. We have to listen and see if there is asymmetrical chest moving up and down, so that we can see if rescue breathing is necessary, and if we know the proper technique, we should carry it out. If the person is semi-conscious or conscious, we should place the patient in a recovery position until the ambulance arrives. Do not move the person. However, if there has been or may have been a neck injury, and if there is bleeding on the site of injury, we should also not move. Let's say if it is a stab wound, we should not move the knife out of the person's chest. Just hold a clean cloth around the person's bleeding area. And to stop bleeding, we should just put slight pressure but not too much pressure in instances of complete and non-stop bleeding until the medical personnel has arrived. That is all from me today. Thank you so much for listening.